All right. So welcome, everyone. Welcome to our healthcare track panel for Twin Cities Startup Week. Thank you to everyone joining today, both our panelists and those in the audience. My name is Tim Roman. I'm CEO and co-founder of Ecotone Analytics, a Minneapolis-based social impact analytics consultancy. I'll be interviewing the panelists today for the first 30 to 35 minutes, and then we will bring forward questions from the audience for the last 10 to 15. Please ask questions in the chat throughout. First of all, before introducing our panelists, I'd like to set the stage for the conversation today in the following way. The racial and social health and welfare disparities illuminated by the COVID-19 pandemic and amplified by the global protests in the wake of the murder of George Floyd have drastically accelerated the momentum and need for real solutions to complex health equity problems. Opportunities for social impact and social equity focused entrepreneurs are growing as vendors and service providers, change makers, and community supporters. Connecting entrepreneurs in the accelerator and investment community could be critical to driving change, increasing equity, and expanding opportunity along the way. We hope that our panelists here today will help to open a window into their worlds and give the startup community a line of sight into the needs and areas of concern that are of great importance to our expert panelists. So first, I'd like to take a few minutes to have the panelists introduce themselves, their organizations, and their work. Let's start with Callie, and then Joan, and then Dr. Farah.
Hi, everyone. Happy to be here with you today. Thank you for that introduction, Tim. My name is Callie Chamberlain. I work at Optum, which is one half of the United Health Group, and I oversee their corporate social responsibility program. So what I would say about our CSR program, just at the highest level, is that it's not a traditional CSR program where we're doing grant making, but it really is working across our business units to think about the ways in which we can advance equity as just a part of our everyday process, operations, and culture. And then thinking about the ways in which we can center community and lift up the voices of our most marginalized populations to really drive the work that we do across the organization. So excited for the conversation and happy to be here.
Thank you, Callie. Joan?
Yeah, good afternoon, and thanks, Tim, for the invitation to join these other two ladies. My name is Joan Pennington. I'm the Senior Director for Community Benefit and Measurement for mHealth Fairview, where I've been serving for many, many years, but in this community space for a number of years. And our business unit really is responsible for looking outward into community and understanding where the needs are greatest in the community and how we as a healthcare system can come alongside those community populations and neighborhoods to really bring about health equity and improved community health. My team specifically is charged with many of the regulatory responsibilities that include a lot of data and information and reporting. And so really delving into those specific community characteristics. So happy to be here and have this conversation with you all today.
Thanks, Joan. Dr. Farah?
Hi, good afternoon, everyone. My name is Dr. Farah. I am a physician leader at People-Centered Clinics and Services. It's a nationally recognized, federally qualified community health center. We serve a diverse population, particularly East African communities, the Somali and Oromo communities to be specific. And my role is to leverage data and use data analytics to transform how we deliver care. Traditionally, care has been delivered with one community in mind, and so I have the esteemed privilege of being able to look at all of our diverse communities, cultures, and traditions, and embed that in the care that we deliver, so that it's more reflective of who we're serving. And so that is what I get to do every single day, and I get to find ways and solutions to sort of reduce the racial equity gap, the racial health disparities in our communities. Thank you. And I'm excited to be on this panel with these esteemed guests as well.
It's intimidating, to be honest. You guys are amazing. Thank you so much. So to get started, and to be most efficient with our limited time, I think we'll go, I'll throw the question out and we'll go in order of our introductions. So Callie, Joan, Dr. Farah. So the first question I'd like to ask is, think about what's happened in 2020. Please share your thoughts, experience, and context on racial and social inequalities and inequities that have always existed in our culture, but have been laid bare and accelerated by the COVID-19 pandemic and the reaction to George Floyd's murder.
Yeah, there is so much to say in that question. There's so much that has been, to your point, laid bare. We are overdue for this. And now we're starting to see what the impacts of that looks like across our various systems and within our communities. And so what I would say is that from a UHG perspective, again, I know I had said we don't do grant making. We did do grant making in the wake of the murder of George Floyd. And I'm really proud of the way that we showed up, which was to say that we selected community partners that were in communities on the ground, had existing relationships, and were doing the work already. And we came in and said, how do we partner with you and lift up your work? What do you need, right? You're expert in this space. You know what the values of this community and ecosystem are. We just want to support you. And so we gave unrestricted grants. We built capacity by providing pro bono infrastructure building to the organizations that we partnered with, as well as some of their partners. And then we paid for, the education of George Floyd's children. We are working on an innovation center with the YWCA. So I think, all of that is good work, but what's been really important for our organization is to step back and say, how are we really showing up here? Mm-hmm. Like, what is our responsibility to our communities and in what way, right? Like, what's the sort of tone and structure in which we want to engage with the people that are already here and really build these more meaningful relationships moving forward? The other thing I would add is that this also is applied internally, right? So we're looking at training all of our providers in implicit and unconscious bias by the end of 2021. That's 4 out of 5 providers in the US. Mm-hmm. We're looking at our hiring practices. We're looking at our promotion structures. So not just saying that this is our external presence within the space and the way we're thinking about the inequities that exist, but also internally, right? We're going to do our own work. And we're going to think about the ways in which we can better operate to align to what this moment calls us toward.
That's awesome. Thank you, Callie.
Well, similar to Callie, M Health Fairview, of course, was just really, I think, had to pause to really reflect on the murder of George Floyd and sort of the implications. And I think immediately looking sort of inward at our own organization and, how are we coming to the community? We're a system of 11 hospitals, 50 some plus clinics across the state of Minnesota with over 34,000 employees and serving, thousands of patients every year. And how do we show up with all of those various constituency groups, as well as being a partner in the community? So similarly, there were grants that were made out of our foundation. But one of the things I think I'm very proud of is several weeks after George Floyd's murder, and we had to recover. We had many of our clinics were vandalized during the riots, so had to work through all of that. But our CEO put a stake in the ground, and the first thing was really to call out racism as a social and public health issue, and then did something that we're all very proud of. But he commissioned a group called the Hope Commission, actually, and really to look at advancing equity in key roles that our organization plays. So as those roles include, obviously, we're an employer. So how are we looking at inclusion and our employment practices in light of anti-racism? How are we showing up as a healthcare provider to our patients, As we look at our clinical quality, we're doing a lot of work at just delving into our quality metrics and looking at where we have health disparities. As being part of the University of Minnesota and an academic institution, then how is that showing up in the education space as well as our research? And then the area that I'm involved in is how are we showing up as a corporate citizen? So as we're an economic engine in the community, you know, we purchase goods, we hire locally, we invest in the local community, but what does that look like in light of health equity? And then we're a community member. So how are we joining arms, if you will, with the community to really address these social equity issues? And so I'm really proud of the work that's moving forward. And as a matter of fact, while we're having this panel, our CEO, as well as the Dean of the Academic Medical Center, is they're hosting a forum for over 600 of our employees as a listening session right now, as we're talking here, and listening for what is their experience, because they're the experts in how they're experiencing racism. So
Thank you, Joan.
thank you.
So for People Center, it's, you know, we're unique in that community health centers have been founded on the premise of advancing equity and fighting for what's right and making sure that people have the same opportunities and have the ability to lead successful, healthy lives. And so this is something that has been that's woven in the fabric of our being, and so that we lead with the core of equity and making sure that that we're transforming communities, not only necessarily providing care, but finding ways to address needs and show up in spaces to really elevate and amplify, you know, the voices of things that are outside of care, but that still impact one's ability to really fully be present in life. And so, you know, when we talk about COVID and we talk about in the wake of George Floyd's murder, it elevated some of the pervasive racial disparities that have existed for years. And as a result, you know, we've had to find creative, innovative ways to be able to still serve in and with our communities with the current, you know, social distancing practices and things like that. And so how have we done this? We've done it by, you know, making sure that we address, you know, the need for testing and going out into the community, not necessarily waiting for them to come to us, but going into public high risings, going to certain places across the Twin Cities to just bring access to people and meet them where they're at. How else does that look like when people identify, you know, food insecurities or needing assistance with rent or needing assistance with financial support, that we link them directly with community partners that we know, that have been vetted, that we know are going to be taking care of these individuals like we would. And so just finding ways to eliminate some of the burden that our communities face. It's having a space for individuals to really be able to have conversations with behavioral health therapists. And the unique thing, again, about community health centers is we don't turn anyone away for their inability to pay, right? And so in essence, you know, we are here, we care about the welfare of people. We care about making sure that they have the same right to be able to build wealth, to be able to break cycles of poverty, and lead lives that the generations to come will be able to bear the fruit of. So thank you.
Thank you for that. So would it be safe to say that access and affordability is one of the most important social determinants of health?
Mm-hmm.
Transitioning into our next question. My second question is the social determinants of health. And for those of you that aren't hip to that term, we're talking about non-clinical factors like geography, transportation, healthy food access, healthy behaviors, perhaps cost, distance, and accessibility are of growing strategic significance in and around the healthcare world. How does the inequity we touched on in the first question result from barriers to access or the social determinants? And what are your organizations doing to integrate social determinants into strategy, operations, and decision-making?
Yeah, it's a great question. Also a really big and complicated one.
Yeah.
Yes, of course, which is the point, right? But I think Hennepin County did something really incredible when they said, racism is a public health crisis. This is undergirding everything, right? All of the social determinants of health, in my opinion, are a result of racism. So when I think about, that's not necessarily my organization's perspective maybe, but like we are thinking about what are the ways in which people are coming to the four walls of a clinic and how do we start to think more broadly about what our strategies and interventions need to be? Because truly at that point, you're already working backwards. And so how do you really be thoughtful about who your partners are? How do you really be thoughtful about how you're deploying funding? What are the other capacities that we can bring to bear in terms of data and analytics, looking at root cause analysis? For Optum, I mean, we are a major player in the health space. So it's imperative that we're thoughtful about the way in which we show up and being able to link those different partners together to say, this might not be where we're playing, right? Like this is not our central focus is transportation and housing and all these other things. But it is so important when we think about actually managing care within the four walls of a clinic and hospital. So it's really defining a lot of the way that we're thinking about how we move forward. And it's not just the data, right? Like lived experience is a data. So a data point. So it's also just talking to people, listening, again, understanding what people need. There's so many strengths and values that exist in communities that I think historically we maybe have not been as close to as we are now. And so I'm really excited about the approach that we're starting to take with that integration and that lens and that broader definition of health, healthcare, and well-being.
Mm-hmm.
Callie, I love how you called out stakeholder voice and participant voice as data, as a data point.
Yeah.
That's fantastic.
Yeah.
Thank you.
That's
Joan?
great. So yeah, thank you. And Callie, I agree, this is a huge issue. I think one of the things that I would lead with is the fact that I come from a healthcare provider, health system. And, traditionally, that is the social determinants have not been the first place that healthcare providers have gone to looking at the social determinants. So I would say that, this has been a long time coming to really move the systems along to be able to even use the word social determinants of health. So I want to say that. Having said that, I would say healthcare, on the other hand, has been mission driven since their beginning in terms of doing good in community and in partnership in the community. And Fairview is no exception to that. And I would say that, there are systems in place now that are mandating that we really look at and get at the sort of the root cause, to use your word, Callie, at what is causing, some of these downstream issues, what is really at the root cause of some of that, and looking into that data and information is part of the work I know that we're doing from a community health needs assessment standpoint. But there's the data, and then there's talking to people, and that is really at the core of I think the work that we're doing is saying, yeah, here's what the data is showing, but in order to get to root cause, you need to really, and to look at those upstream determinants is to go into community and say, what are your lived experiences? And then those become a way to then address those issues. The other thing I would say about that is in addressing the issues, it's not like we can come in and say, oh, let us, fix this for you. It is really about co-creating, co-designing. If we've not had those lived experiences, so all the work that we do, we look to others and to really work with us, alongside of us, so that things are, the work that we're doing is culturally responsive, linguistically responsive, etc. So as we're out there, but then again, getting at those root causes, and so it might be food insecurity, it might be housing, it might be economic. And so how can we come alongside? So that's what I would say for how we're looking at this and approaching this.
Awesome. Thanks, Joan.
So, for People Center, I think we've known for many years. We're coming up to our 50th year in existence here in the Twin Cities, so we're pretty excited about that. But we've known from the start that that the social determinants of health is they represent 80% of whether a person is able to reach optimal health or not. And so the way the healthcare system right now is designed is one that is it's reactive, it's curative, so it's very disease specific. And so if there are things happening outside of the realm of healthcare, right? As Joan and Callie both mentioned about housing and how not having lack of housing and food insecurities and education gaps and unemployment. I mean, we're all starting at a disadvantage, right? And so how can we even begin to really serve our patients when all these are the burdens that people are carrying? And so what we do, how we position ourselves when serving patients is helping them kind of address those things that are impacting their ability to really engage in care. What does that look like? As I mentioned earlier, right? Taking away the things that is stressing them out. Mm-hmm. And we know that stress complicates one's ability to really their condition. And so by slowly taking away those things that are creating barriers to care or adding stress, then you start to see somebody that becomes engaged and is interested about wanting to really manage whatever condition that they may have, right? Eliminating, as we know, social determinants of health has a one-to-one relationship with health outcomes, right? We also know the cost burden of not addressing those things. And so by just looking at the things that impact one's ability to really manage their care and removing those barriers, you get to have somebody that actually is able to really then have a chance at reaching optimal health. And so People Center tries to find ways, either through partnership, either delivering the services directly at our sites or partnering with community partners in the community to deliver those things.
Well, again, a perfect segue to the next question. Which is to get into the specific, we've identified some of these barriers and this expansion of the boundary beyond the clinic and beyond clinical care into the community and a focus on outcomes. So I'm going to pass it to Callie and we'll go around again, but I want to know now, what are some of those, I want to make sure I'm reading the right question, but it's about specificity. What sort of innovative programs or strategies are you and your organizations working on to address these issues specifically?
Yeah, I mean, Dr. Farah's it's amazing that I get to go after her because then she just sets up my answer perfectly.
I don't need to be here.
She had said, it's about removing these barriers so that you have the best possible people showing up to the best possible care environment. So a lot of our focus right now, or my focus right now, I guess at Optum, is around our maternal health strategy and looking at the disparities that exist across our country, specifically for Black and Indigenous women. And a lot of the way we think about that is like, if you are a provider, what is preventing you from really fully engaging with your patient and providing personalized care? You're probably burned out. You probably have administrative overload. You may have implicit bias that's not being addressed. There's a number of things that come into play. And then similarly, if you're a birthing person, right, you may not feel comfortable advocating for yourself. You may not feel safe in your healthcare environment. You may not have a relationship with your provider. You may have social determinants of health. So again, if we think about changing the outcomes around morbidity and mortality, you can't start in that environment. That's one dimension of it, but it's really going to require this more holistic approach. Otherwise, again, you're always going to be working backwards. And so one example that I'll give is one of our pilots in North Carolina is with a spiritual health organization that has deep community relationships. And they intervene at the point of somebody calling 911 for a domestic violence situation. If there's a pregnant person that is in that situation, they will take them to a family law center, and we're working with them to build out what those pathways could look like in terms of education, housing, are you going to your prenatal appointments? What kind of support do you need? And really thinking about what is our role as a payer and as Optum, which is not payer, but technology and, just systems and things like this. But how do we sort of like wrap around the person and make sure that you have the systems of support and the communities to access, to be able to enable you to show up as your best possible self in the four walls of a clinic, not just for the birthing person, which is what the IPV pilot is focused on, the intimate partner violence pilot. But again, similar mentality for providers. We have, again, like this more holistic approach, more expansive thinking about, we want to control what's in an environment here, and that is going to require us to totally zoom out and then work with other partners that are very established in these other spaces to make sure that we're all working together to get best possible outcome, like in that one-to-one connection. And the intimate partner violence pilot is one of the ways in which I think we're doing a really good job of being very thoughtful and being very community-minded in terms of the strategy that we're going to implement on the ground.
That's amazing. Thank you.
So the example I guess I'd like to share actually stems from our needs assessment, where we looked at really high rates of chronic disease among our clinic patients in the east side of St. Paul. So we delved in and we said, all right, so where do these people live? What what are the characteristics of where they live? And then as we started to delve in and started to talk to the providers and the patients involved, what we realized was they might have a chronic disease, but as we got upstream, we realized that it was really the food insecurity was an issue for them. So we reached out to partners, and Dr. Farah, this is the story where the physician opened his physician's toolkit and looked inside, and he said, I don't have any tools to help these patients to mitigate food insecurity. So we partnered with the Hmong American partners to really, or the Hmong Farmers Association, I'm sorry, to look at, could we bring CSAs into the clinics that were relevant and for the Karen and the Hmong patients? And they said, yeah, we'll customize some CSAs for that group of patients. So we started off with...
So to be clear, Joan, Hmong American Farmers Association was providing CSA boxes. And if people don't know what that is, that's a box with fruits and vegetables that are fresh and at a place that you would expect.
Yeah, thank you for that. And we started with about 20 families. Actually, we started with about 10 families. The next year, it grew to about 20 families, and then it was 40 families. Now, you can imagine that it's 40 families, but that's, probably at a minimum, 120 people that were affected. But the outcome was amazing because we were able to track, how was their BMI doing? How was their total cholesterol? We were looking at their A1Cs to track their glucose. And there was some amazing ripple effects with this, because a patient and their family would get a CSA box and they wouldn't know what these Southeast Asian vegetables were. So they'd go to their neighbor and they'd say, you know, how do I prepare this? And so then that started, you know, a relationship among neighbors. So there were so many great stories that came out of that. Today, we're, instead of just 1 or 2 clinics, I think this year we're in 9 clinics. Of course, that had to be modified for COVID. Those turned into grocery store vouchers. But it's just amazing how you can look at how you address those social determinants, get upstream, and then watch how that might affect some of those downstream health issues.
So there's if I think about innovative programs that People Center has, there are a number of ones that I can really talk about. I mean, we have the Hoyo project, which is Hoyo stands for some mother in Somali, and it's a prenatal program bringing women together to talk about their birthing experience. It's talking about some of the challenges they face when they're pregnant, how to eat when you're pregnant, right? With a cultural lens. It addresses, it creates it's community led. So there's a prenatal patient that is actually leading the conversation and facilitating the space. And they oftentimes are the ones deciding what topics they want to discuss, from health conditions for patients that have diabetes or hypertension and pregnant, from the emotional toll and mental toll of being pregnant, and also raising a family, right? To talking about the challenges of advocating for oneself in hospital settings, right? And so, in a way, this program is a self-discovery and a self-empowerment program, and in a space where women are able to really have conversations about things that they typically haven't been able to ask before, because of that, that sense of your provider is an authority figure, right? And therefore you're worried about either offending them or being shamed for not doing something. Right. And I think we're all guilty of it. We've sometimes not followed or taken our medication, right, when we were supposed to, right? There's a diabetes program that I can talk about where we look at the way that we deliver care, especially when you're talking to new immigrants in particular that are not used to the Western diet. It's hard for them to stay in control of their diabetes or hypertension when you ask them to eat foods that they've never seen before, like kale, right? Or that doesn't grow in their country. And so taking alternative foods that are common in their communities and in their cultures, and using that to really create these strategies that we need to help manage patients with chronic conditions. I can talk about just having our dental program, where beginning to have conversation about the teeth and the importance of the keeping up with the cleanings of teeth and avoiding the foods that are sugary in our diets, so that it doesn't lead to chronic conditions, right? Or it doesn't lead to other challenges, right, down the road. And so we were always constantly thinking about ways to create solutions for our communities, and in a very culturally responsive way. I can't hear you.
That happened. I want to keep an eye on the time because we've got 19 minutes left, but I don't see any questions in the chat. So I'd love to continue with some questions that pivot off what you were just talking about. We've talked about a little bit about data and indicators and characterizing stakeholder input and listening as a data point. And Dr. Farah, you were just mentioning how those, and Joan, everyone, you were mentioning about how those listening sessions may affect strategy and the kind of programming or resources that go back into the community. But I'd like you to think now about how do you use data or qualitative feedback in a feedback loop to either improve those programs or modify them as they're moving forward. And I'll let Callie go first again.
Yeah, I think one of the things I immediately start to think about is just scaling. Our pilot programs, for example, are hyper local, and of course you can't just scale that because every community is different. But I think inherent within that is, of course, a lot of the things that you're asking about, which is the tracking, the measurement, the qualitative side of things from all parties that are involved, but also the outcomes in terms of clinical improvements that we might be seeing, and then thinking really strategically, thoughtfully about who our next community partners are going to be at our next pilot location, and looking at ways that we can kind of start from a different baseline, define new metrics, but try to take the general sense of what the pilot is and embed it into a different, community, benefit from some of the outcomes that we've seen. I think more broadly speaking across Optum, not just specific to maternal health, I mean, we are extremely data driven. And so almost all of our decisions, right, are made on where do we feel like we can have the biggest impact, where are the highest levels of disparities. We sort of landed at the intimate partner violence because we looked around and said, there's nobody that's really here. So this makes sense given all of these quantitative metrics that we have. We're talking to people. It sounds like there's some interest at the qualitative level. Like, here's the opportunity for us now to dive in and try to figure out what might make sense here. So in terms of decision making, yeah, definitely using all of those things that you've named to really be thoughtful about what we're doing and also how we're doing it and who we're doing it with.
Mm-hmm.
Thank you.
Yeah. I agree with Callie that really understanding the outcomes helps you to scale it. I would also add that it helps you to understand where you need to customize it. And I'm thinking of an example. It was a personal experience when we were doing a community health needs assessment, our last one. We had done a lot of work here in the Twin Cities where, we've got a lot of health disparities and we're a very diverse community here in the Twin Cities. We have two hospitals in northern Minnesota, one in Hibbing and one in Grand Rapids. And I don't remember which of those two cities I was in, but I was in a meeting with some groups of people there, and I was talking in general about mental health issues, but I was coming at it from a lens of diversity and how I would be thinking about it here in the Twin Cities. And I was way off the mark. And so somebody came up to me very respectfully afterwards, one of the community members from, I think this was Grand Rapids, and said, Joan, you're in Grand Rapids now, and here's our bigger issues. So I think understanding that community voice and then really understanding, community demographics and characteristics are really important as we go into community. I did my homework after that, let's just say, in really looking at, what is the makeup, even between, we've got a hospital in Wyoming, Minnesota, and how is that different from our hospital and the area in Burnsville or Southdale, which Southdale Hospital sits in Edina. So how is that different? So really understanding those differences, even within, 20, 30 miles of each other. So I think, really understanding that community level data And then we in healthcare have the advantage too of also adding to that patient data. So we can look at our patient data and say, how is that helping to inform decision making, and where we might put resources and where we need to do a better job. And then community voice, we've talked about that. Also patient voice, really important. I can think of when we were doing our very first assessment in 2012, there was a community member that said, you need to do with, not to the community. Mm-hmm. And you know that to this day is sort of our, we've got that plastered on the top as we start to think about how we approach community. I was so grateful for that comment that a gentleman made so many years ago, but has really stuck with us as this is how we need to be thinking about our work.
Mm-hmm. So nice. Thank you, Joan.
Yeah, I just want to kind of reiterate what Callie and Joan have said, and it's really looking at for us in particular, a lot of the decisions that we make. There is influenced by what the community says they need, and that is a way for us to stay true to our mission as an organization, and that we're not, to Joan's point, doing things to the community rather than just providing assistance or finding ways to connect resources to address those needs. And so, besides the data we collect from the community, the patient data that we use, it kind of also gives us a different perspective about where our patients are at in their care. And it allows us to start to have conversations about, okay, what are we not addressing? And ask critical questions about things that we could do differently. Checking to see if patients feel like they're getting the care that they're getting the best care, right? And using all those informations to kind of create strategies to really then address those gaps, right? When we look at health outcomes, that tells us which of our patients need more targeted approaches, or need more resources, or need more services, right? And so there are a number of ways that we use data. We leverage data, like I said, to transform the way that we deliver care and our care delivery itself. The way to stay in touch with our community and figure out and keeping a pulse on the needs of the community, making sure that resources are provided to address those needs, and then to also inform sort of our mission and our vision for how we want to lead in this space.
So we've got about 11 minutes left, and since there are no questions in the chat, I want to put out another question to the group, and that is to kind of bring it home for Twin Cities Startup Week. We're talking about innovations, and we're talking about entrepreneurs as the audience for this discussion. I feel like there have been a few themes. We've expanded the boundaries of what healthcare means through the social determinants in the community. We've been talking about stakeholder listening and having co-development of interventions, and then using data to feedback and adjust on how those things are going. Now, I'd like to ask each of the panelists, where do you see opportunities both within the organization and in the community for innovations and partnership and entrepreneurs to intersect with this industry across that, either the social determinants value chain or somewhere in the community that is outside the traditional boundary of clinical care? Mm-hmm. If you want to take a swing at that.
Yeah, it's a great question. I would say everywhere. The problems are so big and multifaceted, and the system, I mean, we are not just talking about a health system, we're talking about systems within systems within systems. I think in terms of entrepreneurship, I'm sure it's just like, from a healthcare perspective, right? Because I've sort of been on the other side too, is that, do you really understand your community? Is there like a very specific thing that you're doing, that you're representing, that you're seeing missing from the health system overall? Because those are the type of partners that I'm looking for. It's like, I know what I can do with the capability of Optum, right? And there are things that I don't see. So I'm looking for somebody who authentically, deeply, truly understands where their communities are at, what the challenges are, and can meet me in that way, and we can co-create something together, because you're going to bring a perspective that I need. And again, if you're grounded in like the value chain of what exists within your sphere of influence and control, your neighborhood, your community, whatever that might look like, I just think there's so many opportunities, especially underneath this banner of equity, that really we need folks to help be informing the strategies and the opportunities that can exist in this space, because we don't have that, right? And it always needs to be strengthened. We always need to be centering that. So specifically, if you're like representing those identities, I just think the opportunities are truly endless.
Nice, thank you.
Yeah. So the thing that comes to my mind is really, there's a couple of things, but one is, and I haven't even really touched on our anchor strategies, but really as we think about, for Fairview, purchasing locally, who are those vendors, helping us to understand who those vendors are. And it might be somebody who's got a startup, and might be able to bring those innovations into the company, that might be helpful, or help us identify others that we could bring in. The other thing that comes to mind is, just in this era of COVID, we've had to, as everyone here has experienced, really shift how we're doing our work, and it's much more virtual. And so how do we reach those people in their homes? So I'm thinking about the elderly person who's living alone, who doesn't really know how to use technology. What are those technologies that they might be able to use that would be very, very simple to use? I'm also thinking about, again, our rural colleagues where there isn't real consistent broadband. And so really, the whole using any kind of technology is really not there. And there is very limited transportation up in some of our communities. So how do we deliver those services, both in a COVID stay-at-home environment, and then I guess another area would be, how do we deliver those services in a way that is culturally responsive, virtual services, that's culturally responsive, that is in a language that is understandable for our community. So, there's lots of different ways that I can think of, especially in this kind of this new world of being so virtual.
Awesome, Joan.
Yeah, I think, again, I think Joan and Callie raised some very important points. I think in particular, how do we make sure that we are making sure that at the core of what we're trying to do is really advancing equity, right? And making sure that community voice is guiding how we move in these spaces, right? And that and using data, or leveraging data, to really bring about the change that we want to see, both internally, systemically, and in our environment, right? And I think the other thing to think about is, particularly in this time frame during this pandemic, I think all of us, it's not unique to healthcare.
Uh-oh.
Yes, it worked.
Okay, one state of doing business to now virtually standing up virtual services, right? And so now more than ever, innovation and collaboration is going to be critical to our success, right? And making sure that we remain connected to our communities, and that we're constantly trying to find ways to deliver and reach them, right? And you know, as we know, we're probably going to be in COVID for another year or so. So what does that look like? How are we able to deliver? You know, make sure that we remain engaged with them, make sure that we're constantly checking to see if their needs are being addressed, and thinking creatively about how to get those needs, finding the resources and getting those needs addressed, right? I think that the way that startup community can help is, you know, there's a lot of technical skills and subject matter expertise that they can bring to our world to help ease the technology burden that we face. So how do we complement and balance the service that we want to deliver in a community-centric way, right? While using and leveraging data in a very simplistic way as well.
I'd like to invite everyone to stick around for the second hour of our panel on virtual services and innovation. I'm kidding. We've got 3 minutes left, and that really concludes the panel. But what an amazing discussion, and really what a kind of an amazing place to end it, because that extension of services out to meet people where they're at, no matter if that's geography or barriers to in social determinants, I think that is the future. Like, we've not only extended the boundary of healthcare beyond clinical into the community, but now we're unbounded from geography in some way. And so, you know, just like COVID and this, you know, we're in the Brady Bunch thing here now, like what that's done for our business. We're no longer like a Minneapolis-based business. We're coast to coast. And what does that mean for all these industries? How does COVID disrupt these things in this very way that we've landed on after this healthcare discussion? It's amazing. Well, since we are at time, I would like to thank you all so much. Thank you for participating in our planning session, and thank you for showing up in such a great way for this discussion. It means a lot, and I hope, you know, we haven't had a huge audience, but we're recording it, and I really hope that there's a lot of innovators and folks in the community that can get it, that we can spread this discussion around, because I think we created a lot of value here with this, and I'd really love to get this out in front of more people to see these windows into your world and all the opportunity that's there for us to think about how we create more equitable outcomes. So thank you all once again.
Thank you.
Thank you.
So I think we'll say goodbye.
All right, take care.
Bye.
Thank you.